The decision to undergo surgery is the decision of the doctor, not the patient, after exhausting all conservative treatment methods. Decision to undergo surgery or not. And after patient agreement, choice of penile implant. Flexible, 2-piece hydraulic or 3-piece hydraulic. After choosing type of penile implant, we start selection between manufacturers. Here, the decision is complex. Between performing the surgery itself, choosing the type of penile implant, and choosing the company that produces the penile implant, we will talk about all these details in the coming episodes. Let's agree that the decision to perform the surgery or not is the doctor's decision, not the patient's. And I am surprised, in fact, when a patient comes to us and we tell him that you need to have a penile implant, he tells you, no, I don't want to do it. The question is, if you go to a cardiologist and he tells you that you need to have a heart stent, can you say no? Then, in that case, it is the doctor's decision. I come to the decision to perform the surgery after I have exhausted all conservative treatment options. So, it is not acceptable for the patient to say no after I tell him that he needs to have a penile implant. With all due respect to him, this is a treatment, not a recreational activity. I do not ask for his opinion on what car he will buy or what clothes he will wear. No, this is a treatment for a medical condition. It must be treated, if not for him, then for the sake of his wife and family. So, the decision to perform the surgery is the doctor's decision. But when? After exhausting all treatment options. Pay attention to the phrase treatment options, because I am sometimes surprised when a patient comes to me and says, I want to have a penile implant. Why, my dear? I took all this treatment and it didn't work. I look at the prescription he was following. I find strips of vitamins that neither advance nor delay. He went to a doctor who said, we will try this treatment, and if it doesn't work, we will do the operation. The truth is, this is not the treatment we are talking about. We are talking about strong, effective treatment with active ingredients, not just a few vitamins and dietary supplements. That's why here at Dar El-Zakora, we don't just perform surgery on every patient who comes to us and says, I want to have a penile implant. No, we must try all possible treatments with him. Our treatment is strong and effective, and it contains powerful active ingredients. So if after all this treatment it doesn't work for him, then I, as a doctor, will be completely sure that there is no other treatment that will work for this man. And not only that, in some cases, we support our treatment with auxiliary treatment methods such as plasma injections and shockwave therapy sessions. This is not to waste the patient's time or money. It is to make sure that all available treatment methods in Egypt and around the world have truly failed. So why all this? Is it to avoid surgery because surgery is not good? No, surgery is fine. The implant is excellent and everything is fine. But I am sure that there is nothing like God's creation. As long as I am able to maintain the patient's natural erection, I will have benefited and the patient will have benefited. But if the treatment is not working, or it is working but causing him a lot of health problems, or he has a medical condition that prevents him from taking a large amount of treatments, then we have no choice but to perform a penile implant surgery. Therefore, the decision to perform a penile implant surgery or not is a decision made by the doctor, not the patient. And the patient should not come and say, guys, I don't want to have surgery. Find me another solution. Like a heart patient should not say, I don't want to have a heart stent. Like a joint replacement patient should not say, I don't want to have a joint replacement. Like a kidney stone patient should not say, leave my kidney stone to me, I want it. These surgical decisions are determined by the doctor based on the medical condition. The patient should not refuse the treatment here because he is wasting the opportunity to be treated properly. He is allowing the condition to develop to the point where he may reach a stage where he comes and says, guys, do the operation for me. And we tell him it will not work. And this happens a lot, you know. Sometimes we tell the patient, you need to have surgery. He says no. He comes back after 2 or 3 years and he has severe fibrosis, or his health condition has deteriorated, or he has a chronic illness, or his heart condition has weakened. He says, do the surgery for me. And we tell him it will not work. And this happens a lot. So the answer to the first question is, the decision to perform the operation is the doctor's decision, not the patient's, after exhausting all conservative treatment methods.